summer, the season of being outside and enjoying cold drinks on a hot day with your loved ones. It's something we always look forward to, right? Mostly because the alternative could be things looking like this outside. No one really wants to complain if what Mother Nature gives us doesn't live up to that ideal we cling on to in the depths of winter. But it is hard to keep a positive attitude when more and more summer headlines look like these. And look, that's not to say that people aren't having good summers anymore at all. It's just maybe not the idyllic season we once thought.
Yeah, I think I'm probably on the make the most of it side. The heat sucks. I just moved into a new place with no AC. AC needed in Calgary in summer.
When we were at Mount Assiniboine, we left a day early because there was a forest fire that started in Kananaskis and it was getting pretty smoky. So we had to leave a day early because it wasn't very comfortable.
And no, it's not your imagination. Calgary is seeing more wildfire smoke. Data shows that between 1981 and 2010, the climatological average of smoke hours in a whole summer was about 12. Since 2010, you can see that smoke hours have climbed well past the 100-hour mark. Heat and smoke, they both come with health warnings, with an emphasis on vulnerable populations that are most at risk, like older adults, kids, babies, people with asthma or heart conditions. And mental health is a big one too.
We work really closely, in partnership with 211 and the Distress Center and other organizations that operate helplines. And absolutely, they've seen a tremendous spike in calls.
The Canadian Mental Health Association Calgary works in the community to connect people to resources. And they see these kinds of events really weighing on people.
It has a sort of a global effect on our mood and our well-being. If you're in a housing situation without air conditioning, I'm one of them. I can tell you, the house did not cool down at all, and so it has a tremendous impact on sense of lethargy, not being able to participate in your normal routines, not having energy to perhaps do some of the things that you would normally do to lower your stress. It's kind of hard to go for a run when you're leaving a house that's 38 degrees and going outside to 36 degrees and blazing sun. So yeah, it's definitely putting a lot of pressure on people to be able to find alternatives. A lot of it is having to be creative about how you can get some moments of retreat from that sort of oppressive sense of never-ending pressure with the heat and the smoke and the being unable to escape that.
So you might not be on the brink of heat exhaustion, but you still don't feel like yourself. You've got a shorter fuse, or you're feeling like it's too hot to even be close to another human being. Research is finding out there might be something to that.
So in a heat wave, we think about heat-related illness, where we think about heat exhaustion, people passing out from the heat, getting muscle cramps, things like that, and then really serious things like heat stroke, where I see patients in the emergency department that are critically ill from the heat. But we also know that heat can impact the body in a lot of ways. We know that extended temperatures for a long time can impact nighttime temperatures and make it hard to sleep, and that's something that will affect everyone. We also know that increased temperatures and heat waves will cause us to have decreased concentration and memory impairments and decreased cognitive function. So we see this in test scores in kids, that their test scores go down in the heat. We also see that heat increases aggressive behavior and violent crime.
It's not clear if the heat itself is at play or if these trends boil down to a lack of sleep. Research is still trying to determine that. And then there's the compounding effects of a heat wave and smoke. Is it okay to open your windows even if it's smoky outside?
Opening your windows to help with the heat when it cools down might bring in the smoke. I think we know that there are more morbidity and mortality from heat-related illness, so I would prioritize that. But obviously, people with chronic respiratory disease might be more affected by the particulate matter from the wildfire smoke. Wearing a respirator is one way to prevent those effects.
Dr. Wiskell says there will be more of these events, so knowing the risks and adapting is key.
So when I grew up in Calgary, we didn't have air conditioning. We didn't think about it. We didn't have sustained temperatures. And places that aren't used to heat and aren't prepared for it, you're not ready with air conditioning or with other adaptive measures that people know to do in places that do have the heat. So we can learn from others.
So if you're feeling like maybe summer isn't your favorite season anymore, or maybe you're finding that you feel a bit more excited for the change in seasons, you're not alone.
I appreciate the winter more now. I used to like it less, but
Why is that?
I don't know, it's just like you get to be all cozy and Christmas vibes and I don't know.
I'm definitely more of a fall girl, but to each their own, right?
Why is that?
Probably because it gets a bit cooler, but you can still hang out outside. There's still lots to do, right? And the snow hasn't taken over your life yet.